Montgomery County Public Schools guidance from health officials regarding the quarantining process has raised some concerns and questions.
We received a lot of input from a lot of folks saying, well, you can't just look at one symptom, or everything that coughs or sniffles is not COVID. We agree, which is why we've continued to follow the process we've done for contact tracing for schools from last year. And that is looking at the bigger picture and providing an assessment of individual cases for individuals who do demonstrate symptoms and getting a bigger picture before those decisions are made.
MCPS released a new community message this week, which provides additional information about the guidance and tools that will help the school district minimize the number of students who need to quarantine. County Health Officer Dr.Travis Gayles provided clarification during a virtual media briefing on Wednesday.
This says, for the purposes of this decision aid, COVID-19 symptoms are any one of the following: fever, sore throat, cough, difficulty breathing, diarrhea or vomiting, new onset of severe headache, or new loss of taste and smell. And the decision tree in decision aid gives you different categories within which you can look at. For example, this one looks at for people with symptoms who are not fully vaccinated. And the next page looks at for recommendations for persons with symptoms who are fully vaccinated, as well as recommendations for close contacts of the person with symptoms.
Dr. Gayles says the county is following guidelines from the state, with one exception.
There is one area where we do deviate from the guidance from the state, and we have discussed this with the state in prior conversations, and they are aware of our efforts here. It's this category of if a person has symptoms with no negative test results for COVID-19 and no specific alternative diagnosis, what happens for their quarantine? So I want to highlight one quick thing. It's important to this key of no specific alternative diagnosis. So when our staff encounters this kid with symptoms, again, as listed at the top of this page, they do an assessment to find out if there are any other specific things, diagnoses that can explain those symptoms, to reduce the index of suspicion and concern that those symptoms may actually be a COVID case. That includes any relevant medical history from that student, any known or questionable exposures for that student, and they do an investigation to get a full picture.
And weighing in on another full picture, Gayles offers this report card on the county's return to a full classroom schedule.
And just one last thing to put into perspective numbers. We're talking 163,000, close to 163,000 students who returned to MCPS last week. School health staff noted approximately 125 students who were sent home with symptoms concerning for COVID. Do the math, that's an extremely small percentage. And then when you talk about the students who were asked to quarantine for a short period of time, again, we do not dismiss the value of in-person education. Don't get me wrong, we're not dismissing that. But that number is less than 1%. And so 99.3% of the students who attended MCPS last week were able to do so successfully in the setting of significant events happening in the world and being in a pandemic. And we hope that that number continues, and we will continue to work with our colleagues at MCPS as well as our non-public schools to ensure that our students are safe and we minimize the disruptions as much as possible.
Jordan Lindsay, reporting for MyMCM.
Information is key. To stay informed on what's happening in Montgomery County, like, share, and subscribe to our channel.